Hello, everyone, and welcome to this webinar presentation on pregnancy, postpartum, and eating disorder recovery. My name is Crystal Karges. I'm a registered dietitian and a lactation consultant, and I'm so delighted to be here and to talk about this conversation. It's something that's really near and dear to my heart, and I'm just so grateful to the entire Eating Disorder Hope team for having me for this Eating Disorder Hope virtual conference, and I'm excited to delve into this topic. So thank you again for having me, and I look forward to interacting with all of you. So if you have any questions throughout this presentation, please feel free to submit them through the question pane of your control panel. So let's get started. First, just a little introduction about myself. Like I said, I'm a registered dietitian. I specialize in maternal child health and eating disorders. And I also focus on intuitive eating and helping individuals find a peaceful relationship with food, which is incredibly important for so many people. I'm also a board-certified lactation consultant, an intuitive eating counselor, and I'm almost done with my eating disorder registered dietitian certification, which has been really exciting for me and a long journey, a work in progress. I currently have a private practice here in San Diego, where I live, San Diego County, and I serve clients locally and also virtually online. And I've had my private practice for a few years now, and it's been exciting to delve into that and serve the community through my practice that way. I am also a mama of almost 5, as you can see from this picture here. It's a picture of my 4 children, and we're expecting our 5th baby early next year, so we're really excited about that. And I like to share that I am a recovered mama. I have also recovered from an eating disorder, and again, this is why this field of work is incredibly important to me. It's kind of like my way of giving back, and through my own healing and recovery journey, I've really just been inspired to help other women in particular who are maybe struggling through the different stages of motherhood, whether it be pregnancy or postpartum or raising little ones. I know that it can bring up a lot of difficulties for women, particularly women who have had eating disorders. So this is definitely an important topic of conversation and something that means a lot to me personally. So I'm just, again, really happy to be here and share a little bit about myself and my own healing journey and how that has impacted me, and how I hope that that encourages you wherever you might be today. Okay, so in talking about pregnancy, it's important to understand some of the risks that might be involved. So yes, pregnancy is an incredibly beautiful, miraculous experience, and it's coming from someone who has had now 5 pregnancies, but it can also be a very difficult time for a woman who has had an eating disorder either in her past or who might be susceptible to an eating disorder, and this is including anorexia, bulimia, binge eating disorder, even women who have had a history of chronic dieting or who may have just struggled with different forms of disordered eating. The experience of pregnancy can be incredibly triggering, and that can be for various reasons that we will get into. But it's important to understand that while this is a very beautiful and miraculous journey and experience for so many women, that it can also just bring up a lot for a woman who might be more susceptible to having an eating disorder. And interestingly, research has found that over 90% of women with disordered eating were not identified by their medical practitioners. And I think that's a really important statistic to be aware of, that there are a lot of women who come into pregnancy struggling with some form of disordered eating. It might not necessarily be a full-blown diagnosed eating disorder like anorexia or bulimia, but it's still something that is going undetected by their medical practitioners. And this can be their OBGYNs or their midwives. So that's a pretty high number. Also, almost 30% of women who experienced eating disorder symptoms were not identified during pregnancy. So again, that's something that, I'm sorry, I think I might have said that incorrectly. So 30% of women experience eating disorder symptoms during pregnancy. So this is women who, again, may be struggling with a clinically diagnosed eating disorder. And almost 30% of women are experiencing these symptoms during pregnancy. And there's a good chance that that number is probably a lot higher. So most likely more than 30% of women are experiencing eating disorder symptoms during their pregnancy. And the reason that that might be lower is because a lot of women typically struggle with coming forward about what they're dealing with. So because of the stigma surrounding eating disorders, many women who might be struggling aren't necessarily coming forward and seeking out help, which is why the numbers that we see are often lower than what is actually the reality. So just good to be aware that this is definitely an issue. If you have struggled with an eating disorder during pregnancy or postpartum, it's important to know that you are absolutely not alone. And I think that is something really key for women to know and to understand, is that no matter how isolating you may feel in your journey, you are absolutely not alone. And there are so many issues surrounding pregnancy and postpartum and eating disorders, and women need support, and being able to come out and ask for help is the first step in finding recovery. So just keep that in mind. So why pregnancy? What is it about pregnancy that can make women more susceptible to developing eating disorder symptoms, or perhaps having a relapse in their eating disorder? So it's important to know that pregnancy brings about a lot of changes for women, not just physically. I think that's the one thing that we think of. You know, a woman's body definitely changes pretty dramatically within those 9 months of pregnancy to accommodate her growing baby. So that's definitely a given. But also emotionally and mentally, a woman is experiencing so much during this time in this transition. And this can be true for a first pregnancy or a sixth pregnancy. Each journey is unique and brings about a lot of changes for a woman. And it's always, you know, it's not necessarily easy for a woman to adjust to the different things that are occurring in her life. So pregnancy can also bring about a lot of changes in a woman's, you know, home life and her career and her relationships and how she relates to other people, her social life. So many aspects of her life are changing during pregnancy, not just her physical body. And, you know, eating disorders, we know, are the result of several different factors. So people who develop eating disorders, we know from research that there's various different causes that kind of combine to create the perfect storm, so to say. And one of those factors can be life transition. So women who are going through pregnancy and postpartum are experiencing pretty major life transitions, and that can definitely be a contributing factor to the development of eating disorders. Some of the common pregnancy symptoms that women experience can also be very triggering for eating disorder symptoms and behaviors. So this includes, you know, changing appetite, weight gain, just the different hormonal changes, feeling nauseous, those types of physical experiences that are pretty common in pregnancy can be very triggering. So, for example, a woman who may have been in recovery from bulimia can be triggered by the morning sickness that she experiences in her pregnancy. And that can be something that is very difficult to control. You know, you can't necessarily help what your body is going through sometimes during pregnancy. And yet those experiences can be triggering for a woman who has had a history of an eating disorder or who is in recovery. Also cultural messages. So the way that our culture and society is not conducive for a healthy pregnancy overall. I mean, I'm just being very general, but it is hard for women to go into a pregnancy with a realistic expectation of kind of what to expect throughout their journey, just because of how distorted the media has somewhat tainted what pregnancy and postpartum should look like. So if you think about the images that women are being bombarded with, you know, how even in magazines and you know, newspapers and how stories are covered when it comes to women, particularly celebrities. So if you think about some of the headlines that have been splashed across magazines, often include a woman who, or a celebrity who has been through pregnancy and, you know, is bouncing back in her career after just a few weeks, and her body looks amazing and untouched and basically, you know, perfect. And I think women who see things like that are developing a message about what pregnancy and postpartum looks like that's very unrealistic. Also, we just are submerged in a culture that's very diet oriented, and I think that again can cause a lot of women to mistrust their body. So when they're going through pregnancy and experiencing these different appetite changes and weight changes, it can feel very difficult to trust what your body is going through simply because of the cultural messages that we are surrounded by. So it's important to keep that in mind. And I think the combination of both the biological changes that a woman is going through and also, you know, the environment that we're surrounded in can make pregnancy an extremely triggering time for a woman who has had an eating disorder. Okay, sorry, 1 second here. Okay, so being aware of these risk factors can help with early diagnosis and intervention. So just kind of understanding whether it's you personally or someone that you love and care for, if you are able to understand that there are certain risk factors that may increase your susceptibility to having an eating disorder, that can really help going into pregnancy. You know, eating disorders are not necessarily something that can be prevented, but just being aware can certainly help with early diagnosis and intervention. So I'm going to go through a list of some of the risk factors that may increase a woman's susceptibility to having an eating disorder during pregnancy and postpartum. Just keep in mind that this is, you know, not an exclusive list, that every woman's journey is unique, and, you know, every woman experiences pregnancy differently. So, but just some, like, again, being aware of some of the risk factors that may be involved can help. And I think going into pregnancy with awareness and being willing to take some preventative measures can go a long way. So here are some of the risk factors that may increase a woman's risk of developing an eating disorder. So any woman that has had a history of chronic dieting and then becomes pregnant, that can definitely influence how, her pregnancy goes. And it's important to know that, again, like I said, pregnancy is different and unique for every woman. So for some women, pregnancy is a motivating time to really take care of their bodies, to take care of their health, to really take those steps towards making sure that they're doing everything possible to have a healthy baby and a healthy pregnancy. But again, for other women, this might not necessarily be the case. So it's not safe to always assume that a woman will take care of her body simply for the sake of the baby. That's not always the case. So for a woman who has had a history of chronic dieting and is now pregnant and coming into pregnancy, these changes in her body can definitely be triggering and upsetting. And, if you're used to controlling your weight through certain measures, it may be hard to adjust to weight gain and seeing your body gain weight and knowing how to best handle that. A woman who has had an irregular period or even an absence of a period can be at increased risk, unplanned pregnancies. So for a woman who may not have necessarily been planning on being pregnant and is then now finding herself in the situation of caring for and growing a newborn baby or a baby, that can be very difficult to cope with and can certainly increase the risk of an eating disorder. Having a history of certain mental illnesses, this includes eating disorders, also mood disorders such as depression, anxiety, other mental illnesses like PTSD, OCD, even addiction or substance abuse, that can, again, increase the likeliness of eating disorder behaviors during pregnancy. Also, an experience of trauma in the past. So if a woman has experienced any type of physical, emotional, or sexual trauma, that will definitely increase her susceptibility to an eating disorder when she's actually pregnant. And for a lot of women who have unfortunately been through something like this, it can feel really difficult to have a connection to the baby that is growing inside of you. And a lot of women who've experienced some form of trauma may feel disconnected from their bodies, particularly during pregnancy, and that's just a coping, kind of a coping mechanism. So it's important to be aware of that. Also, malnutrition. So if a woman is coming into pregnancy malnourished and, whether from another chronic illness or from a past eating disorder, if she's coming into the pregnancy malnourished, that can certainly make it a bit riskier during her pregnancy. So I started talking a little bit about this, and I'll kind of delve into this more, but what is the cultural impact on pregnancy? And again, this is making it more difficult, I think, for women to go into pregnancy with a healthy mindset and ability to take care of themselves and their bodies. If you think about the way that our culture is structured and how our society, thinks about women, talks about women, it's very hard on women today, especially during pregnancy. So women are usually taught that you can't trust your body. This is before, during, and after pregnancy. It's very difficult for a woman to often feel like her body is okay just based on our society and our culture alone. Usually our cultural messages are telling us that our bodies are not okay, that we need to fix them, that we need to change them. And those types of messages actually can cause mistrust in our own bodies. So if we're constantly hearing that, you need to buy this diet product or you need to change the way you look, that sends the message that your body is not okay the way it is, and therefore it can't be trusted. So this is really difficult. And again, this is not something that can necessarily be prevented. I mean, this is just a result of being in our culture and our society today, and women are subject to these messages on an ongoing basis. Weight and body size are often the measures of success. So, women are also taught to believe that if they reach a certain size or obtain a certain weight or, fall within a certain category of their weight and size, that they will be successful or they'll be loved. And again, this is a very difficult message, and one that is hard for women, particularly going into pregnancy. It's difficult to kind of undo those thoughts when you're now pregnant and caring for a baby in your body. So, and I chatted briefly about how celebrity pregnancies and the media's influence on what pregnancy and postpartum looks like can create an alternative sense of reality for women. I think we see pregnancy and postpartum being very glamorized in the media and in our culture. And again, not that it's not a beautiful thing. It's a very beautiful, exhilarating, and terrifying journey. And I don't think the media necessarily covers all the different aspects that are included in pregnancy and postpartum. We often see everything that looks good, and we don't really see behind the scenes of, what's really involved during pregnancy. And I think, again, that influences our perception on what pregnancy actually is. And then when it comes to weight gain, a lot of women have different perceptions on weight gain during pregnancy, and typically there's the idea that, weight gain is okay if it's within a certain range. And that's an idea that's, perpetuated by our culture, but also by our prenatal healthcare system, which I'm very sad to say is not where it should be. But oftentimes, healthcare providers and practitioners, although they may be very well intentioned, can, mention like, okay, we want you to gain this much weight and that's it. And that can be really triggering for a woman during pregnancy, especially if her body may be gaining more weight than what is quote unquote recommended. So it's important to keep that in mind. So what is the impact? We've talked a little bit about the risk of eating disorders during pregnancy, but what is the impact on the mother and her baby? So if an eating disorder is left undiagnosed and untreated during pregnancy, this can definitely result in some harmful and dangerous consequences to the mother and the baby. So when mom is not getting adequate nutrition during pregnancy, this can certainly affect the growth of the baby. So oftentimes risks to the baby include a low birth weight or preterm delivery. So mom might actually deliver earlier than would be expected, which can certainly have a lot of consequences on baby. If the baby doesn't have the full amount of time to develop inside mom, then that can certainly result in a lot of side effects as well. And for a mom who may be malnourished or dealing with erratic eating behaviors during pregnancy, she may also be at risk for miscarriage. And there's also a higher risk associated with cesarean. Now, not to say that there's anything wrong with having a cesarean delivery, but it can definitely involve some other risks and complications. So some women who have eating disorders that are left untreated during pregnancy might be more at risk for having a cesarean delivery. So we definitely want to help support women in navigating these different weight concerns that may come up during pregnancy. And I think this is one of the most common issues that women struggle with during pregnancy. And again, it may be a beautiful thing for them to see their body changing and accommodating this growing baby inside of them, but it can also be a little nerve-wracking, especially for a woman who, let's say there's a woman in recovery who may not necessarily be weighing herself very often, but all of a sudden you're in your prenatal care, you're seeing your health practitioner every few weeks, and one of the first things they do in your appointment is weigh you. And for a woman who may not be used to seeing her weight, or who may not be weighing herself, or who's simply not used to seeing her weight fluctuate or weight gain, this can be really upsetting. There's often a lot of hyper-focusing on weight during pregnancy, and that can bring up some real fears for a lot of women, and again, trigger that need to want to control something that feels very out of their control. And that's, again, where the eating disorder behaviors can come into play. It's a very tangible way of feeling like you have some sense of control over your body by controlling your food, by controlling how much you're exercising. And for a woman who is dealing with, fear of her weight changing and being out of her control, it's really easy to resort to those types of eating disorder behaviors. But again, attempting to control weight during pregnancy can lead to some very serious side effects for both mother and baby. So what can you do? How do you approach this? And this is a really difficult thing. Again, because of our society and our culture, and also just the lack of education in our prenatal healthcare system, it's hard. It's hard for a woman to go through pregnancy and really feel like she is supported and that she has the means to kind of work through and process how her body is changing and how her weight is fluctuating. And, I can speak for myself as someone who is in recovery and also, who's been through multiple pregnancies, that things sadly have not changed much since my first pregnancy to this pregnancy. And it definitely takes a lot of advocating for yourself, especially during your prenatal care, and just being aware that your health practitioner, there's a good chance that they will not know how to support you, and that they will likely do things that are triggering to your eating disorder, or just triggering in general. So it's really important to be aware of that, and also to learn to become your own advocate during your prenatal care. One thing I wanted to discuss really quickly is the weight gain guidelines that are often brought up during prenatal care. So, like I said, your OBGYN or your midwife might point out and say, we really want you to stay within this weight range, or we don't want to see you gain more than X, or, and it's important to understand that the guidelines that they're using are pretty outdated. So the research behind those guidelines is very old and hasn't been updated in quite some time. And it's based on your pre-pregnancy BMI, which literally means nothing about your health. So if you're feeling like, there's no way, or, if that, I think that creates a lot of undue stress for women. They feel like they're seeing their weight escalate, and it may be going beyond what their healthcare practitioner has recommended, and that in itself can be really stressful. And I think, again, that can trigger those eating disorder behaviors and that need to have to control your weight, which is dangerous during pregnancy. It's important to understand that your body knows exactly what it needs to do to grow that baby inside of you. And for some women, that means gaining a lot more weight than what is recommended. And just keep in mind that these guidelines for weight gain recommendations during pregnancy are pretty outdated, yet it's something that our present healthcare system continues to use. So, again, becoming an advocate for yourself during prenatal care, and we'll talk about this more towards the end when we talk about preventative strategies, but that might mean asking for blind weight at your checkups, and saying, I don't want to see my weight, and, I don't need to see it, and I don't need to discuss it, and kind of setting those boundaries at the very beginning so that that is not a factor that is, affecting you during your pregnancy. So also women are coming into pregnancy just having to deal with some of these potential challenges. So again, a lot of this is cultural and environmental. One of the common things that pregnant women experience is just comments and advice, and, that's kind of the first thing that people see in a woman, especially someone who's more obviously pregnant. It's, like, oh, wow, like your body's changing, or your belly's so big, or, a lot of people will reach out and touch your belly without asking, or, and that can make a woman feel violated in certain ways, or even just insecure about her own body and how her body is changing. And you have to remember that women during pregnancy are experiencing a myriad of changes, not just physical, but emotional, in her relationships and everything. Everything about her life is changing. And it's so easy to just see a woman for her body during pregnancy. And oftentimes, even comments that are intended to be, considerate or nice can come across rude, or a woman who might be pregnant can take it in a totally different context. So those are some of the challenges she might encounter. Also, just lack in the medical care system, and I kind of touched on this, but our prenatal care system is not really educated and conducive to support women to have the most optimal healthy pregnancy possible. And it's really sad to say, but it is true, and it does take advocating and kind of asking for what you want and need, and just realizing that you might not necessarily always get that in the prenatal care that you are seeking out. There's incredible stigma surrounding eating disorders, so if, again, I mentioned how some women are coming into pregnancy, or who might find themselves struggling with eating disorder behaviors during pregnancy, and it can feel very shameful, or a woman might not necessarily understand why she's doing things that she's doing, or it can be difficult to talk to someone and just be honest and let them know, like, hey, I'm really struggling with this. And that's because there is so much shame and stigma surrounding eating disorders and just mental health issues in general. So that can be a challenge for a woman during pregnancy. And just, feeling like you don't have adequate support through all the different transitions that you're going through. So these are all some of the challenges that women are facing during pregnancy. So how can you support a healthy pregnancy? And this is something that's really important. And, whether you're trying to have a baby, or you are currently pregnant, or pregnancy is in your future, wherever you might be, it's important to know that there are definitely ways to set yourself up with kind of those preventative strategies to support a healthy pregnancy. So meaning that you're able to take care of your body adequately and be symptom-free from eating disorder behaviors, and support, the normal healthy growth of your baby, and take care of and nourish your body. So it's crucial to seek out multidisciplinary help. Again, like, you're most likely going to be having some form of prenatal care, whether it's with an OBGYN or a midwife, but it's really important to build a treatment team. And this includes a therapist, a psychiatrist, and a dietitian. All of these professionals can contribute very meaningfully to your overall support system and make it easier for you to really navigate pregnancy and the different challenges that you might encounter. It's important to have regular support at different stages of pregnancy. So things might, change depending on where you're at in your pregnancy. Some women feel like they need more support at the beginning. Some women might feel like they might need more support towards the end and transitioning into postpartum. So it's really important to just kind of keep a finger on what you're needing and the frequency of support that you're needing, but to be ready with your treatment team and already have those people in place that you can go to if you find yourself struggling. You might go in and see your dietitian once every couple of weeks to monitor your weight or to make sure that you're getting all the nutrition you need to support your baby and yourself. It's just important to have those relationships established with your healthcare professionals so you can see them regularly and consistently. If you are entering pregnancy and may, have had an active eating disorder and still do have an active eating disorder in your pregnancy, it's really important to take advantage of all the help that you can get. In some cases, if the eating disorder is severe, seeking out higher level of treatment may be necessary. So it might be helpful and crucial to, temporarily go to a higher level of care, like a partial hospitalization, even IOP, intensive outpatients. In some cases, residential might be necessary. It's really important to be realistic about where you're at. And knowing that seeking help does not mean that you're a failure. It doesn't mean that you're weak, that you can't do this. It simply means that you are getting the support you need to ensure that you have the help necessary to get through this. So when you're pregnant, how do you face the challenges related to food in your body? And this is one of the hardest questions, I think, for women to navigate because it's always changing. And like I stated earlier, this journey, pregnancy is very unique to women depending on the person, depending on, their past, their history. But one key that I cannot overemphasize is advocating for yourself and just remembering that not everyone that you encounter is going to understand where you're at or where you've been or what you've struggled with or what you need to feel supported. So you have to learn how to really advocate for yourself and ask for what you need, asking those hard questions, setting boundaries with people who are in your life who may be toxic to your life, It's really important to learn to be your own advocate. And this is a hard thing. And, if you feel like you can't advocate for yourself, it's also important to recognize that you can always enlist the support of other people that and that you trust and who you feel like understand you, and having other people also advocate for you. So, that might be meeting a partner or a spouse who can go with you to your prenatal appointments and remind your physician or your midwife that you don't want to see your weight, that, talk about your weight is not necessary, things like that. So it's good to remember that if you feel like you're not in a position to necessarily advocate for yourself, that you can always lean on the support of people that you do trust. Learning to trust and listen to your body and not the scale. So again, we're given the message and we're always taught through our culture and our society that our value and our worth is in our weight and what the scale says. But that is not the case in general, and especially in pregnancy. Like, the scale cannot tell you what you need to grow your baby and support your growing baby. What you should be doing is listening to your body. Your body has all the innate wisdom that you need to grow your baby and to take care of your body. And it's important to really tune in and listen to what your body is needing. Eating consistently, feeding your body adequately. This is a big one too. There are so many fluctuations with weight and appetite during pregnancy, and again, that can make a woman feel really scared and fearful about some of the changes that she's experiencing. And, you know, prior to pregnancy, a woman might be used to eating a certain way. You know, maybe she only has 3 meals and a snack a day, but suddenly during pregnancy, that can change pretty dramatically. She can feel hungry every couple of hours or wake up in the middle of the night feeling like, you know, she's starving. So it's important to know that you have to eat consistently. You have to feed your body. Your nutrient and calorie needs are increased and higher during pregnancy. So it is important to not only listen to your body, but honor it and make that proactive choice to feed your body consistently what you're needing. Developing a support team. So having a support team is really crucial, like we discussed, you know, whether it's a, you know, therapist and a dietitian in addition to your OBGYN, or if it's more comprehensive, like actually being enrolled in a treatment program. That's really important to have that in order to successfully navigate some of the challenges that you might be facing. And ultimately, maintaining open communication with those that you trust. So, you know, the journey of pregnancy changes, and some days you might feel really great and confident in yourself. Other days you might really be struggling. And the best thing you can do is maintain open communication with the people that you trust and that you know that understand you. So transitioning a bit into postpartum, there's a lot of similarities between pregnancy and postpartum. It's important to know that the postpartum period can be equally triggering for a woman, especially those who have had an eating disorder in the past or during pregnancy. So postpartum is after you've had your baby. Typically, it's considered the 1 to 2 year period after delivering a baby. And women who have had a history of an eating disorder do have an increased risk of mood disorders like postpartum depression and anxiety. So again, the postpartum period is one of those transitional times in a woman's life that can create a need or a sense of feeling like I need to establish some sense of control over the changes in my life, and food and body and weight can become a very tangible means to do that. Some women even women who have had eating disorders, may find that pregnancy is an easier time to take care of themselves because they actually feel and see their body growing this baby. But oftentimes what will happen is women will experience a relapse, not necessarily in pregnancy, but mostly in postpartum, because they're no longer, necessarily directly growing a baby in their body. So it's important to be aware of that. So what are some of the specific risk factors during postpartum? We talked about how women with eating disorders may experience a relapse. One of the big things is that attention and care will shift from mother to baby. So mom during pregnancy is having frequent care. She's usually seeing her health provider every 4 weeks and even more frequently towards the end of her pregnancy. And after she delivers her baby, she literally goes from having all those appointments to having one postpartum checkup, usually about 6 to 8 weeks after she delivers her baby, and that is literally it. Here in the United States, we do not have adequate postpartum care for our moms, and for me personally, that's one of the most frustrating things to see is that, moms are faced with inadequate care during a time when she needs even more support. Suddenly she's home with this newborn baby and now facing all these changes in her body again, pressures from culture, from society, from family members, and it's a really overwhelming time. And now, by having the demands of the newborn baby to take care of, there's even less time for self-care for a new mom. So it's really easy to push her needs to the back burner. A lot of moms may not find adequate time to eat or sleep, even taking a shower, and maintaining a sense of, regular hygiene can be extremely difficult. And all of that can contribute to risk factors. Overall, mom is just adjusting to a new identity. She's now mom, she's now caretaker, and that baby is 100% dependent on her. And that can be really overwhelming, and that can be a hard transition for a lot of women. So the combination of all of these factors can make it very difficult for a mom who is transitioning into postpartum. So what is the impact of eating disorders on moms during postpartum? Well, for one, there's an increase of postpartum mood disorders like postpartum depression and anxiety. That those mood disorders in postpartum are also associated with various other risks. So, that's a pretty big one. Mom may feel detached from her baby. She just may have a harder time bonding. This can influence how she's feeding her child. The infant nutrition can be at risk. And overall, it can just be more difficult for moms to recover from pregnancy and childbirth. So, if mom is not getting adequate nutrition and not caring for herself, then this can certainly, prolong her recovery process and make it even harder for her to fully recover and feel better after delivering her baby. So again, a lot of these measures in postpartum are similar to pregnancy. Like you want to establish that multidisciplinary care, really making sure that you have a postpartum plan in place as a preventative measure. So setting yourself up for a support group, setting yourself up with appointments with your therapist, with your dietitian, with your psychiatrist, getting all of that in place before you even deliver. Even if you don't think or know if you'll need it, it's important to have that in place as a form of self-care and protection for you and your baby. Also kind of finding a way to prioritize self-care during postpartum. And I think this is one of those things that a lot of moms might not realize until they're actually in it. But, suddenly simple things that were easy for you to do before you had a baby can become a lot more challenging. And this can be things like feeding yourself, getting adequate groceries, things like that. So it's important to have a plan in place and set up some strategies and resources to help yourself navigate this when you do transition to postpartum. So what is the role of the dietitian? And I'll just kind of go over this briefly, but there are definitely various health practitioners that can support a healthy pregnancy and postpartum for mother and baby, particularly for a woman who has struggled with an eating disorder or who is, experiencing any type of relapse. It's really important to emphasize that a multidisciplinary team is the most effective approach to take. I'm just quickly going to highlight the role of a registered dietitian. So the dietitian ideally would work with and collaborate with other healthcare professionals on the treatment team. So therapists, the psychiatrist, the OBGYN, the RD will be involved in collaborating with everybody. But there's many things that the RD can help with, including providing a structured meal plan, which for some women that may be necessary in order to ensure that they're getting all the nutrients that their body needs to support their baby and themselves during pregnancy and postpartum. An RD can also assume the monitoring of the weight. So if you're asking and wanting blind weights at your prenatal appointments, some OBGYNs may be hesitant to that, but again, that's when you can kind of offset it to your dietitian and say, well, I'm working with a dietitian and she's monitoring my weight, and RDs who specialize in this area are able to monitor your weight and can kind of handle all of that so that you don't necessarily need to worry about that or have that be something that is triggering for you. So that's another thing that RD can help with. And just generally supporting positive body image, providing guidance with intuitive eating as appropriate. So if you're a mom and you're really just struggling with what do I feed myself, how do I know what I need in pregnancy, like navigating all those different changes that your body goes through can be really confusing. So having the support of a dietitian can be very helpful in terms of kind of figuring all of that out. And, the role of the RD, that can change over time and as you progress through pregnancy and postpartum. For example, if you choose to breastfeed your baby and are just wondering, how do I best feed myself and my body to keep my milk supply up, a dietitian can be helpful with that. Also with child feeding, so transitioning your baby to solids and, how do you establish healthy feeding habits in your baby from an early point of view or an early start. So a dietitian can be really helpful for that as well. I would definitely encourage looking for a dietitian who specializes in eating disorders or I would say, and also the what's called health at every size approach. So you want a dietitian who is going to support your body and your weight at any size and any shape. You want a dietitian who takes a non-dieting approach versus a dietitian who, might be inclined to recommend dieting. That's something you definitely want to avoid. So there's so many fantastic dietitians out there, and there's a lot who do virtual work, and again, that might be difficult if you're trying to get your weight monitored and checked during pregnancy, but definitely know that a dietitian can be a very helpful part of your pregnancy and your postpartum. So just a few resources that I wanted to highlight, and there's so many out there, and that's kind of the great thing about having the internet and support to the internet or support through the internet is that we do have connection to a lot of resources, which is fantastic. So to start, Eating Disorder Hope has a ton of great articles on pregnancy and postpartum, so definitely check out their website at eatingdisorderhope.com, and you can just search for pregnancy and postpartum, and there's a lot of great articles that will come up there. Also, my own personal website, I offer a lot of resources on pregnancy, postpartum, breastfeeding, child feeding, and eating disorder recovery. So feel free to check out my website. It's crystalkarges.com. And then I've listed some other resources here and websites that I feel do a great job of supporting women during pregnancy and postpartum, particularly those who may be susceptible to an eating disorder. So that pretty much wraps up my presentation. Thank you so much for your time and for sticking with me and listening to this. And I hope that this has been helpful, and hopefully if you have found yourself in this position, that you're able to feel encouraged and get some information that is supportive to you wherever you might be on your journey. So thank you so much for listening. I do have my contact information here. If you want to reach out, I am more than happy to answer any questions you might have. My email is just crystal@crystalkarges.com. And again, my website, my social media handles @crystalkarges for Twitter and Instagram. And then you can find my Facebook page is Crystal Karges Nutrition. And one thing I would just emphasize is that there is absolutely hope for recovery and healing at whatever stage you may be at. So please keep that in mind and know that there is support wherever you are, and it's about reaching out and asking for the help that you need. So that concludes my presentation. I do see that there's a couple questions, which I am more than happy to answer. If you have additional questions, please feel free to enter them into the questions pane of your control panel. One question I have that I see here is, what resources did you find were most helpful to you during your recovery? And that's a great question. I appreciate you sharing and asking that. And again, I think this is very individual based on the person and what you're needing. I feel very fortunate in that I had a few solid years of recovery under my belt before my first pregnancy, but definitely having support, therapy was really crucial and key for me, and that was something that I maintained during pregnancy and postpartum, so I can't recommend that enough. I think just having someone that you can trust and talk with and kind of process the different changes that you're experiencing is really important. And so definitely make sure that you have a support team. And like I said, it could be whatever it is that you're needing. If you feel like you need more therapy, seeing your therapist more frequently. If you need more nutrition support, seeing your nutritionist more frequently. That's really important, so definitely recommend that. Another question here is, how do you navigate food cravings during pregnancy? That's a really good question. I think that can be really confusing for a lot of women, especially a woman in recovery who, may still not feel like she can 100% trust her body. And sometimes in pregnancy, you get the weirdest, oddest food cravings. And I do really believe that our body has the innate wisdom that it needs to tell us what our body is needing nutritionally, and sometimes that's manifested in food cravings. So you might get really odd cravings for random foods, or even foods that may be like fear foods or things that you avoided in your eating disorder. And I think it's really important to honor your body and allow yourself to have those things that you're needing and wanting, and there's probably a good reason behind it. And if you're feeling scared and unsure about how to best do that, I think that's another thing you can work on with your dietitian, and that your dietitian can help support you too. So that's a really good question. All right, and the last question I see here is, how do I navigate morning sickness during pregnancy when in eating disorder recovery? So again, this can be a really hard thing. Morning sickness is a frequent symptom experienced in pregnancy, and I don't know why they call it morning sickness. Sometimes it's all-day sickness, and some women get it worse than others. Some women literally cannot keep anything in their bodies. And I think, again, it's important to get the help and support you need. So if your morning sickness is severe to the point that you cannot keep any food or liquids down, it's really important to seek out medical help and evaluation for that. You don't want to risk being dehydrated or potentially malnourished. So again, if it's something that's very severe, definitely get evaluated by your medical provider as soon as possible. There are more extreme forms of morning sickness than others. If you're experiencing, the occasional bout of morning sickness, or if you find yourself throwing up and it's very triggering because it's reminiscent of being in your eating disorder, again, make sure you seek out the help that you need. And this is where I think it would be important to have a plan in place in terms of what would you do if you get sick, if you weren't able to keep down something that you ate, what can you do to help support yourself after something like that would happen? And this is where your dietitian and therapist can come in really handy and helpful. So I would say having that collaborative approach to what you're going through. And there's also ways to kind of help maintain some of the symptoms with morning sickness. So having small, frequent meals throughout the day, always keeping something in your stomach, maybe staying more towards the blander foods, avoiding anything with strong smells or flavors. Sometimes that can be triggering to morning sickness. So it's important to keep those things in mind, but hopefully that helps a little bit. Thank you for that question. So that wraps up the questions that I've had. If you do have more questions that you think of, please ask away, and I know that I will be able to answer questions even after the webinar. So if you want to go ahead and put them in, I'm more than happy to address them for you. Thank you so much again to Eating Disorder Hope for allowing me this opportunity to participate in this online conference. It's just such a pleasure to be here and to share a little bit about myself and just my experience in pregnancy and postpartum and eating disorder recovery. So very grateful for the opportunity. Thank you to the whole Eating Disorder Hope team. And again, please check out eatingdisorderhope.com for additional resources and articles. And that concludes our webinar. Thank you again for being with me tonight, and I wish you all well. Take good care.